Indian classical music is understood through rag, sur, tal, etc. But have you ever wondered about its application for treatment? Our next guest speaker will be the best person to introduce this concept to us. I take this opportunity to welcome Dr. Shekhar Kulkarni, sir. We all might recognize him from his films, but today, sir is going to talk to us about Indian classical music therapy. Dr. Shekhar Ramesh Kulkarni, sir, is a consultant breast surgeon. Sir has trained at Tata Memorial Hospital, Mumbai, at QE Hospital, Birmingham, UK. Sir is the pioneer in the field of breast surgery in Pune and has a dedicated breast practice for more than 25 years. Sir has been postgraduate teacher at BJ Medical College and has been a member of board of studies at MUHS Nashik. He is also the founder of Astha Breast Cancer Support Group, which has been adjudged as the most successful breast self-help group in the Western Maharashtra. He is the proponent and student of Indian classical music therapy and has conducted many workshops and has been involved in many patient-based research projects. Sir also runs a YouTube channel on music therapy and conducts courses on music therapy for students. Sir is the principal investigator of the thermography trial for breast screening and of an IBE breast scan trial for breast screening. Sir has a successful career in the film industry and Sir is also a writer and poet. I request Sir to kindly come to the stage.
Thank you and good afternoon to you all. Dr. Sethia has made my job very easy because he has already talked about psychosomatic diseases and bridging across different paths. Actually, I maintain that there is nothing called Ayurveda, homeopath, allopathy. We just have good medicine that works for patient. So even if something is in homeopathy that works in our so-called modern medicine, we actually adopt it every time. Most of I treat cancer, and many of my cancer drugs, chemotherapy, come from plants. So I don't think there is any distinction between different paths. We are all together. We are doing the same thing, and because he has also spoken about PNI axis, psycho neuro immuno axis, so my job is now little further easier because music therapy is a very, let's say, new topic to Indian masses and Indian doctors. So let me start. Uh, Actually, music and therapy, if you really consider properly, both are extremely complicated, extremely complex subjects. Indian classical music is an ocean of music, and therapy is equally complicated and a complex thing. So, this one complex thing complicating another complex thing makes the whole issue very complicated and difficult to understand. When Padmanabh told me, he asked me actually to talk in this conference, I couldn't say he's a very dear friend of mine and I couldn't say no. But then I realized that actually I wanted to speak about this to an August gathering like this because of two things. I'll tell one incident. Two of my friends 6 months ago came to me fuming with anger. They had just returned from an inauguration of a music therapy clinic somewhere in Pune. I won't tell the names, but they were actually fuming. They said, there's such a fraud going on here. The person who is giving music therapy is neither a doctor nor a musician. He is delivering or giving 6 weeks of online course at a huge fee, and he is teaching, he's making people music therapists. So I think this is cheating. So I said, let's calm down, let's see what is happening. But then I realized that music therapy, for me to talk today, have two components. One is music therapy market, and one is music therapy as a topic, as a medical scientific topic. Regarding this market, I do not know whether this is the right place to talk about it, but there is a huge quackery going on. Many people, without understanding what is music therapy, because it comes very easily. Somebody who has passed 3 or 4 music examinations and somebody tells him that this rag is for this rogue, starts giving music therapy without taking any responsibility. They don't even know the implications and complications of a doctor patient contract and what actually comes out of it. So when I started doing music therapy, my colleagues said, if you have heard a name of Dr. Anil outside, he was very close to me. He said, कशाला क्वॅकरी फालतूपणा करतो, तू सर्जन आहेस, तू सर्जरी कर. But you know something, I was convinced in the hearts of my heart that this has a strong, very great potential in treating my patients. And so I continued in spite of a large criticism from my colleagues. And today I am here not to give you knowledge, but to share few experiences and maybe gain some insights from you, because you also are all practitioners. You deal with patients, you deal with their minds. Music is so closely associated with the mind. So I would try to give you an overview of what is music therapy. It's a very useful tool for everyone. Actually, when Badmanab told me, do you have any presentation or something? I just saw a very interesting presentation with humor and cartoons and all. It was so good. I told him, no. I'm just going to talk about music therapy. But then when I stopped and started thinking, it is such a huge topic that unless I stick to some points, it will be a haywire discussion. So I thought I'll make some few points where I can focus on certain things and can make this lecture useful for clinicians like you. Because just discussing theory will not lead us anywhere. So I'm a general surgeon. I specialize in cancer surgery. I super specialize in breast surgery. I do breast surgery. I used to work in Sanjeevan Hospital also, where Dondu Mama Sathe, I think many of you are from homeopathy probably. Uh, I have so many Ayurvedic friends also with me. We actually collaborate in various trials regarding Ayurvedic drugs. My teacher, who was my postgraduate uh, teacher, Dr. Patankar, urologist, he also works very closely in Ayurvedic drugs. So probably now the time is ripe for us to all come together and start discussing each other with each other all our nuances and knowledges. Right. So how did it begin? Like when I say I am interested in music therapy, I am a little music enthusiast also. I am a singer. But I got an opportunity to work in a film called Nitar. I do not know how many people have seen that, but it's a beautiful film. All of a sudden, I got a chance to work as a hero in a film when I did not even know how the camera looks. So it was just a stroke of luck that I got into that, because the directors were, if you heard, Sumitra Bhave, Sunil Suktankar, a good duo, and they used to make brilliant films. I was a fan of them, and suddenly someday they approached me and said, "Will you work in our film as a hero?" I said, "Why not? Of course I will. Who says no such an opportunity?" But what was happening? I was so closely involved in this whole thing, because it's a film is something that is created from nothing. Something comes in somebody's mind, nothing is there before that, but slowly people come together, and you actually you make something tangible, something good. So I was so curiously involved in that making of the film. I wanted to learn the craft, to the idea of making films. So one day after a day shoot, you must have heard, if somebody of you are involved in films, they will know this terminology. But you watch rushes, what was shot yesterday. So there was a shot where the hero goes to the airport, the heroine is leaving the town, and they are all sad, and they exchange some emotional dialogues and all. So that was the scene that was shot a few days back. It was edited, rough edited, and then we sat down just to watch what's going on. Nowadays we can do it on the computer. Even then it was on the computer. So I watched that scene. It was good. I mean, I watched some few people were there. We discussed about the thing, and we went away. Next day, I again happened to go to Sumitra Maushi's house, and again this time that day, the same scene was being played, and they were doing something. I again watched that same shot or same scene, let's say, and on that particular day, it was sounding enormously different than yesterday. It was exactly the same scene, nothing changed. Editing was also the same, maybe some minor corrections, but it was hugely effective and impactful. And I did not realize what is happening. Yesterday, I watched that same scene, and today it is looking and sounding so great. Then I realized that they had put a background music on that film, that shot. And that music had enhanced the emotions of that scene to such an extent that actually it brought tears to my eyes. It was so good. And I realized I'm anyway a music fan, so I realized this is something very powerful. This is evoking emotions. Just addition of some good music is evoking such a powerful emotion. There must be something, and we have all heard the tales of Tansen, that he used to sing Malhar Rag, and it used to rain, or Rag Deepak, and they used to have burning lights and all, whatever. But we are slightly convinced that music has a power, but to actually realize that power and maybe put it to the use to the patient, as Dr. Setia said, that we have to put this to the use of patient and make him happy. That day I realized that yes, there is something very powerful in this. It is actually moving you from inside. It probably has some biological impact also. It's not just the cultural impact, maybe biological impact. And I must look into this thing. This is very effective. So that was the first thing. Then next a few days after this incident, we I've founded one organization. Now in my introduction they talked about called institute called Astha Breast Cancer Support Group. It's a support group. It's a self-help group of breast cancer patients. They all come together and work for each other and work for society also. So what they do anything for the patients. Like it's a group of patients, and some patient needs somebody to sit at home or give them mau bhat or something. They do it for patients because patients are in an extremely vulnerable emotional state during their cancer treatment, and these people who have already undergone that feeling realize that helping at that time is very important. So this is a support group. In a nutshell, they help each other. So there was a patient who was a wife of an orthopedic surgeon. She was suffering from breast cancer. And unfortunately, that breast cancer had already gone into her brains. So it was a metastatic stage 4 disease. And it was almost inoperable, untreatable, because they were she herself was an anesthetist. And both of them were from a good background, medical background. All the treatment in the world was already given to her. But the patient was not coming out of that. The brain mets were growing, and the patient was lying down on the bed for probably more than 2 or 3 months. When our Astha people came together and they decided, what can we do for this patient? They have everything, they have money, they have medicines, they have support, everything, but they wanted to do something for that. So they thought that one of the patients, or let's say member's son, used to play santur. And they decided that we'll go to her house, that anesthetist's house, and we'll play santur for her. Let's see, for whatever. Who's decided about, who thought about that, I do not know. But then we decided we will go to her house and play santur for her. So actually we did. It was a rainy season. On an overcast evening, we reached home. That son who used to play the santur came from his office, brought his santur. It was a kind of late evening. So we went into her house. It was typical patient's room with the smell of medicine, smell of glucose biscuit, and suffocated everything. Like, I mean, you can really feel the patient's room, and the patient was lying on the bed. Nobody spoke anything. That my boy took out that santur and he adjusted the strings and all. And because it was evening time, he played marwa, because marwa is a very effective rag. So it went on for 35-40 minutes. It grew darker because it was already evening. It turned into night. That marwa sur, where surrounding the whole atmosphere, all of us were sitting there. The husband, the mother-in-law, the small children were standing on the door, in the door. And after he finished that marwa, everyone had forgotten to even switch on the light, even though it was night, dark. When somebody switched on the night, we saw that the patient was sitting on the bed. The patient who was lying for 3 months used to get up only with some support for some daily chores. She was sitting on the bed, her eyes, which had lost the vision, not actually vision, but drushti, like, I mean, it was just a lost kind of thing for 3 months. Now we could see that she was looking at that boy and she said, "Thank you." So this was after 3 months. She spoke some meaningful thing. Before that, she used to get hallucinations and shout irrelevant things. But that was a day after that marwa for 40 minutes. She stood up in the bed, sat up in the bed, and said thank you to that boy. After that, after this incident, she died in say 1 or 2 weeks. We knew that we are not going to cure her or heal her, but actually we did something for those 45 minutes which really moved her, which impacted her. And even that time it was a good revelation for me that this is very effective, working. Then again, after some time, my cameraman who stays in Bombay, his daughter got a alveolar rhabdomyosarcoma. It's a very bad disease, and she was put on chemotherapy. She's just 17 years old girl. She got this alveolar rhabdomyosarcoma. They started giving chemotherapy, but after some time they decided to come to Pune because there was some good support here, relatives and acquaintances. So they decided that we'll come here, and that girl was subject to chemotherapy. So this chemotherapy was going on in a hospital. All of you know that after chemotherapy you get leukopenia. The WBC count goes down, and after some time it again goes up, or you have to push it up for the next cycle. Otherwise, patient goes into infections or septicemia. Bad. This girl, 17 years old girl, actually after one cycle of chemotherapy, you know the usual blood cell count, white cell count is between 4,000 and 11,000. Her count became 700. So she was put into ICU because you need barrier nursing at this time. People cannot walk into such a patient who is having 700 count. She will contract infection anytime. A young girl. So we gave an injection called filgrastim. She was not being treated by me. She was being treated by some other oncologist. So he was giving filgrastim. That's a granulocyte stimulating factor, if you know that. So it pushes the WBC up. Those injections were given. The count from 700 became 400, then 250. This count just wouldn't come up. And then they realized that something serious is happening. Probably she is now dying. Even the mother and father reluctantly gave consent for no resuscitation. They said की जाणार आहे तर जाऊ दे आता शांतपणे, कशाला त्या बिचारीला त्रास द्यायचा. She was suffering from chemotherapy, डोक्यावरचे केस गेले. It was very bad. And a young girl dying slowly is a very pathetic, painful scene to see. So, but because I am a doctor, so I had a permission to go into that barrier nursing room just to talk to her. You have some privileges of being doctor, even though it is forbidden that you don't go into that. But I, with all aseptic precautions, I went to her to talk to her. Even though her count was 250, she was conscious and alert because nothing had happened to her brain. So only a few days back, I had created one music therapy module. I'll explain to you what that music therapy module is. But I said that, Savni, you like music, I know. So I have one module. I'll put it into your phone and you start listening to that. Let's see what happens. And she happily accepted that. And anyway, she had nothing to do. किती वेळ वाचणार काय करणार. So she was alone in the barrier nursing into ICU. So I gave her that music module, therapy module, and I went away. The second day I had a camp in Tadiwala Road, this railway quarters. We were doing some breast cancer screening, awareness, other things. And at around 11 o'clock, a phone rang from that friend. I thought that now this is the end of the story because now she was anyway dying. If she did not die during the night, she must have died in the morning because she was very bad. He said the blood count is 13,000 that morning. I do not know what happened. 13,000 blood count. She was taken out of ICU in 2 days. She was discharged. And in the same year, on 8th of March, my Antarashtriya Mahila Din, she performed with she was an enthusiastic singer also. So there was a program at Vasai. We have a program called Healing Harmony where my patients and I sing and do awareness programs. So she sang with me in that program. She had a last wish. Make a Wish Foundation had approached her because she was a young girl. She wanted to go to Arijit Singh and listen to him and meet him. That was her last wish. She did that also. And she sang with us for two programs. Ticha Azoba Ajji came from Satara to just watch her on the stage. And she was, brightly sparkling eyes, and she performed. Of course, after she died after a few, maybe 1.5 years after that incident, because that was a bad cancer. But again, it was a reconfirmation of the fact that music works. Music works biologically also. It is not just quackery. Okay, now I must tell you that I'm a scientist, and I'm sure you also know that these are all anecdotes. Anecdotes do not make science. You have to make it science. Anything can happen. Somebody goes and eat tulsi pan and becomes something, stops getting stomach ache. That does not become a therapy. It's just an anecdote. So we decided that we will think about it. We will not just go by these incidents. This maybe the Savni's blood count was actually raised by filgrastim, which was given 3 times beforehand. Who knows what happened? Or that anesthetist lady. We are not sure. It's just a very naive way of looking at science. That because I gave music and she improved, that means it was music that worked. No, we should actually put it the other way round, and we should contradict ourselves. We should be our devil's advocates and say that no, 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 something else must have happened. So I started working in this field. Let's see what happens. Although I know humans are stupid animals, collective human wisdom is brilliant. I have a full faith in collective human wisdom. And what has transpired over all those years, we must first learn, we must first read, think, ponder before we go further. So I was thinking whether this music is a biological entity or a cultural entity, because nothing in nature is without purpose. That's what I feel. Maybe there are things, but I feel that whatever happens in nature, in our body, has some purpose. So is there any biological purpose to the music, or it is just a cultural thing? Darwin used to say that music is for the successful recreation or procreation, not sorry, procreation, successful mating. So a bird song is a call for mating. The bird which sings more beautifully, powerfully, melodiously gets more mates, and thus that bird can procreate, have more children, can reproduce or multiply the genes. That's the biological purpose of any human being or any living organism. So that is probably singing is a for mating. Another thing that was discussed, what's the purpose of music? So humans are social animals. Humans cannot live in isolation or singly. So for being socially successful, you need to have some qualities, and music is one of the things which binds with the group, social group, for to singing together, having celebrations together, having festivals together, that binds more people together. So singing or music is a binding agent for socially active animals. Was another thing that was considered as a evolutionary background for music. But there were opponents to this view also, because Spencer was one of the opponents. He said that no, but birds sing even during non-mating season. What we call singing may not be singing. That is what you perceive as a singing. It's just a call. Who knows whether the birds actually experience those emotions or not? No, nothing. There's one thing that they used to uh, postulate, let's say, is a spandrel effect. They said that actually what evolved was language. The centers for language, the neural connections was for language evolved. That was for language, and music was a kind of byproduct. And they called it spandrel. Spandrel is when you form an arc like door in a square frame. So in which case you get two triangular spaces on the top. There's an arc and there's a rectangular wall. So this triangular space is generally done with good design, beautification, and all. It can be very good. It can be lovely. The design in the spandrel could be beautiful, but that was not the purpose of the whole exercise. It was to make a door, and because there was a additional space there which could be utilized for designing, so there was a music. So they said that music is a byproduct as a spandrel of language thing. So there are so many things which we studied. There were so many observations. Plants and animals. We have always heard that if you put a classical music in the farm, you get more yield of fruits, more yield of vegetables. There were actual experiments that hens kept away from the flock, if they became very unstable, their hormonal and internal milieu changes. But if they are subject to classical or good music, the hormonal levels come down. Similarly for dogs, for fishes, there was plenty of exercise. You can go to the reference material internet. You will find thousands of such references. But we know that music affects animals, music affects humans. There was a Mozart effect that was observed in people, that the children who listen to Mozart music are good in mathematics. That's what they said, and that was this belief was going on for many years. Again, there was an observation that most of the Indian classical musicians like Alladia Khan, Allauddin Khan, Balakrishna Boisel Karanjikar, even Bhimsen Joshi, Gangubai Hangal, Prabha Atre, who died, they all had a very big longevity. If you calculate, it was 98, 90, 89. Especially at the time of our independence in 1947, our average lifespan was around 46. During that time, these people, these musicians, lived to about 80, 85, 90, and people thought that probably that's the effect of music. And this actually, these musicians have a very irregular lifestyle. They have odd hours of their rehearsals and the travels and the programs. Most of them have very good habits also. You must know that. So in spite of that, if they lived for 80, 90 years, it must be the music that is causing that. Especially for percussion instrument players like tabla players, actually it is observed that they live very long. Maybe because of their posture in which they sit for hours, maybe because they do some kind of percussion that acts as acupressure or something. Nobody knows about this because there have been no experiments, but observations are that musicians live a long life, and maybe that's the effect of music. I think I'll keep my watch here, otherwise I can go on. There were other scientific experiments about pre-operation tensions, anxiety. So if the patient is anxious before operation, the post-operative period, post-operative follow-up, post-operative results are not good. But if the patient is not anxious, they are really good. If you can somehow relieve the pre-operative tension, the post-operative period becomes very good. Music can attain that kind of effect, was observed. During one experiment, they used to actually measure the oxytocin, the feel-good hormone or social hormone, during open heart surgery. If they played classical music before, during, after this operation and measured the oxytocin level, they used to find that it is increased as compared to the control group. There are now good equipments like fMRI, functional MRI, or EEG, which can actually see the changes, internal changes, the physiological changes, or the electrical changes in the brain after or while listening to the music. You must have heard about mirror neurons and other all things. So we have a lot of paraphernalia with which we can actually see what happens with the music. So we have good things at our hand to do the thing. But all these experiments, all these observations have finally come to a conclusion that if music has a profound biological effect. It's just not the cultural entity, but it's a biological entity. Hence, can be utilized therapeutically. Now, before we say, or if we talk about what is music therapy, let's see whether these are music therapies or not. Like somebody standing in a balcony and some brass band going on daily, and the person listens to that. Does it constitute music therapy? A tailor shop, a person continuous radio going on, Akashwani, Vivid Bharati, Radio Mirchi going on from morning to evening. He constantly listening to the music. Does it become music therapy? I don't know. There was one example of my teacher. He used to tell me that there was a tabla player staying up in the same building, in his same buildings in some flat, and he was a hypertensive person. And whenever he got that hypertension attack, blood pressure shot up, he used to come to this harmonium player and said, Malkaun Swazwa, Malkaun Swazwa. He used to come with agitated, tense, with all veins here, turgid veins. He used to sit there. This person used to play Malkauns on the petty harmonium, and after some time, his blood pressure used to go down, the veins used to go subside, and then he used to go home peacefully. His dog, the harmonium player's dog, also used to come there and sit there listening to the Malkauns. Does this constitute music therapy? I don't know. There was a class of students, I mean, a music class. The students met me, 4 or 5 students met me because they knew I do music therapy or I'm interested in music therapy. They came and just tell, आज आम्ही music therapy दिल्या. We did music therapy for Parkinsonism patients. There was a group of Parkinsons. I said, very good. What did you do? So they said, we sang a song and we played some instruments. Okay, what happened after that? No, they felt good. Well, person can feel good after smoking also. Feeling good is not a therapeutic aim. But anyway, what is Parkinsonism? ते म्हणले ते नाही माहिती. मग त्याला तुम्हाला पार्किन्सोनिझम माहित नाही. You do not know what to achieve with that Parkinson, what medicines are on that, and you still claim that you've given music therapy because you felt that they felt good. Maybe it's a music therapy. Okay, there was one person who read on WhatsApp that if you listen to this music, your sugar level comes down. And he started doing that. Okay. And he felt very happy that listening to this music, this particular music is going to reduce my sugar level. People said, what's harm in doing that? I can ask you also, if there is no side effect of doing such a thing, should it be encouraged? No. Because it gives a false sense of security. It's a very bad, discussed kind of side effect. Because he says that because I'm listening to this music, my diabetes is getting controlled. So what happens if I eat some laddu or something? Because anyway, I'm taking this music. No harm. So it may be actually counterproductive. It could be a disservice to a person by giving such false hopes and false medicines or pseudo-scientific things. I do not know. I'm just asking you. Maybe it's a music therapy also. I don't know. That teacher used to tell me whenever we play Bhim Palas on the stage, half the audience goes to sleep. So that Bhim Palas has some kind of effect on the audience. Half the people, and he used to always say that every time I play Bhim Palas, this happens. Maybe I tried it when I did not get sleep in the night, but actually that did not happen with Bhim Palas. But I'll tell you a secret. If you listen to Bhoop Rag in the night, if you're not getting sleep, listen to Bhoop. And there's one more rag, I forgot. So actually I get sleep at that time. But he used to say that Bhim Palas in the program always puts people to sleep. My friend in Mumbai, actually who cannot sleep, puts on an instrument which creates white noise. To block other noises, they create white noise, blue noise. There are instruments that come, there are in market. But after that, he sleeps well and gets up fresh in the morning. Is that music therapy? I do not know. Many doctors have classical music being played all the time in their consulting rooms. Patients feel good after that. But does that constitute music therapy? I do not know. Now, in all of these cases, maybe there is some music effect on that person or the animal or whatever. Maybe to some extent it is music therapy. But we know we should not go by these things. We should actually try to define what is music therapy, because it's a very designed, purposeful, structured therapy. When you say music therapy, we were talking about allopathy, Ayurveda, modern medicine, naturopathy, Unani. These are faculties, different streams of medicines. So, music therapy, if we actually consider that, can be a big topic, because there are so many diseases, so many drugs, so many things, so many experiments to be done. So, you cannot actually belittle or trivialize music therapy by saying that this rag treats that rog, or my there are teachers in Pune who give their own cassettes and say that you use this particular cassette for this remedy, or this particular cassette for some cancer or whatever. I mean, it's a dangerous thing to do, but that's what they insist. So by that they kind of trivialize the music therapy. So let's try and do find out some scientific things in which we can properly define music therapy. So let's define. I've tried to define it. There is no clear cut definition anywhere in the world about music therapy. We know that US, UK, Scandinavian countries, Japan all have their boards of music therapy, associations of music therapy. So, music therapy is nothing new. We are not trying to invent something new. It's already there. They have certified course, certified musicians. They have their own syllabus, their own ways of giving music therapy. They have therapy departments in many of the hospitals. So for us it is easy, because America is doing it, UK is doing it, so it must be good. So we can also do it easily, because they do it very stringently. They have evidence-based support for that. So first of all, it's an evidence-based. You have to have scientific evidence. A randomized clinical trial, double blind is not possible, but you have to talk in a language that world understands. If you're talking about some scientific thing, you should give them randomized clinical trials or proper trials to prove or disprove a particular thing that you're talking about. Actually, I am conducting few clinical trials, randomized clinical trials for music therapy, for side effects of breast cancer, chemotherapy, and some other things. So if anyone is interested in actually working in the scientific trials, they are all welcome. I need good volunteers who would actually give me some more inputs and more insights. So it is evidence based creative process. You know, I do music therapy, which is basically based on music modules. A module is a 35 to 45 minutes musical piece, which is not just the music but also instructions, also breathing instructions, also singing instructions. It could be active music, it could be passive music, it could be ready-made music, it could be made on spot music. So it's a creative thing. A therapist has to create that musical module at that time, or at least some time before, depending upon so many things. We'll talk about that, but it's a creative process. It's not a static undynamic process. It's a creative process, and a music therapist needs to be actually an artist or a creative person. Another thing I have realized that it has to be a complementary therapy to a main therapy. You cannot have music therapy as a sole therapy for many diseases. It's again dangerous. You can't treat hypertension with music therapy by stopping all other modern medicine drugs. No. At the most, you can do a complementation or complementary therapy with music therapy. So at this moment, if it progresses further, if we get more good modules, good evidence, we can go for a mainline treatment. But at this moment, it has to be a complementary therapy, which gives musical experience. It's not just listening to music, it's a musical experience. I have put many of my modules on YouTube for free for everyone to use and everyone to listen to. That helped. Now, sir also mentioned about Corona time. This I put on YouTube on Corona, during Corona times, for immunity booster, and I was overwhelmed by the response from even doctors and patients that they felt their actual immunity was improved, and that was proven by blood investigations. So it's the musical experience given by a therapist. Now, again, let's define who is a therapist. Who can become a music therapist? A person who is not a doctor, not a musician, can he become a music therapist? I do not know, but maybe yes, because we need an organizer. A doctor does not make medicine; he just prescribes medicine. So there is a lot of music already available in the world. If he knows which music to be implemented in which case for what, and he learns about music therapy from a good guidance, then he can become a music therapist. So I don't think only a doctor. It's good to have a doctor being music therapist because doctor already understands the ailment or the disease part of it, therapy and the therapy part of it. Music can be taught. So but if somebody is not a doctor but a good organizer, can also become a music therapist. Now, does a music therapist need to be a good proficient in music also? No, I don't think. You don't have to be a good singer or a good musician or a good instrument player to become a music therapist. That's what these are my opinions. Over last few years I've experimented and I've realized that any good person, any good well-meaning person who is ready to learn and ready to improvise and improve in their techniques can become a music therapist. I am trying to be brief. This is a on every title I can talk about 1 hour because it's a very huge thing. But just to be brief, so by a therapist to the patient or beneficiary. Now, patient is obvious, but beneficiary. Music therapy is not just given to optimize health, but it can be given to improve personality, to enhance the efficiency also. So it can be given for students. It can be given for employees in a group, employees in a company. So it's not just to optimize the health, but also to improve the existing efficiency level or academic level. So it could be to a patient or beneficiary. Now, patient is such a vague thing to talk about. When I give music therapy to a patient, and if I decide that I'll give one rag or one particular uh, piece module, now that patient could be a music pandit also. He could be a professional musician, or he could be a total duh person in music. He hates music. Now the same thing will affect differently in this person and that person. A person who is already a music pandit will be a differently perceiving man than a person who can barely listen to some film music or nothing. So there are patients who are willing to take music therapy, not willing to take music therapy. So there are so many varieties of patients. Again, the music depends on the time of the day, the season of the year, and because Indian classical music has all those parameters. So a patient can be, so when I teach this music therapy thing, the way we create a medical case paper, we also make a musical case paper. We have to know what is his musical proficiencies, likings, uh, whether he understands poetry, which language should be used. I generally use Sanskrit language for the verses or songs. Either I take it from Upanishads or Vedas or some scriptures, or write a Marathi poem and get it translated from someone, because Sanskrit can be relatively universally accepted. If I start singing in Marathi and a Gujarati or a Tamil patient comes, he will be completely lost. But a Sanskrit language is reasonably accepted all over India and sometimes internationally also. Again, there is a notion that Sanskrit pronunciations, Sanskrit uchars have their own additional effect on human psyche. So maybe because of both of things, I prefer to have Sanskrit as a medium of songs. But of course, instruction language can change. It could be Marathi or English or whatever which is suitable. But so whether patient understands poetry, whether patient can sit there, because you have to be very ritualized model. You cannot say that kasai bas kutai ai kai kar asa nahi. You have to sit in a particular position, you have to breathe in a particular That's ritualization is very helpful. You're all doctors. If you tell some patient that you take this tablet at 7:35 in the evening and 8:15 in the morning, he will do that, and he'll be benefited more than any random thing, because ritualization can have some impact on your social psych also. So making it ritualized makes it standard also. It can have its own effects also. So through this whole music experience is given through the classical music per se, and other components which are breathing components, omkar components, which could be, it's not just the music, but a guided imagery and powerful suggestions that can also work very wonderfully. When you tell a patient that close your eyes, and on a screen of your mind just see that your cancer cells are being attacked by your white blood cells, your scavenger cells, and your cancer is slowly getting destroyed, or you're getting cured. Actually, we have seen there are experiments that just by good mental imagery, guided imagery, there is a profound therapeutic effect. This is mainly used by sports people. You must have known that sports people, before preparing for Olympics or major tournament, do this mental exercise of guided imagery, and their performance improves, because your mind is a very powerful thing. That mind here also works, and it is supported by music, or sometimes you can say music which is supported by your mind power, but that helps a lot. So other components are all these other components, like your posture, your breathing. Pranayam is a very well known accepted thing for health promotion, or various health benefits. So these are all components, not just put on music and the patient listens. No, there are other things which are mixed with the music module in a very nice way. Even the nivedan, the narration should be very friendly. In many of my modules, I have used voices like Harish Bhimani. I've asked him to narrate, because we need a voice which is very friendly, which is very known to you. If some unknown strange person in a harsh language tells you something, you are not going to accept. Your mind, your subconscious is not going to accept it. But a friendly, neat, good voice spoken in good language can actually help you. So narration also is important. Your choice of words is also important. So making a module is a different art altogether. So through classical music, I stick to Indian classical music mainly, but if the patient is fond of some other kind of music, we start with that music and slowly come to this music. Nowadays, it's as sir said, it is psycho-neuro-immuno axis that we are going to tackle. Here also, it's mainly the psycho-neuro-immuno axis. So if you want to go to neuro axis and break that chain or cycle, it's not easy. Or immunity. Immunity is the least understood thing of all medical faculties. You don't understand immunity. Even now, after this advent of scientific things, you don't understand immunity. But P, that is psychology, PNI. Psychology is mainly emotions. So you can actually break this cycle at that point. When this PNI axis rotates in the normal way, you get health. But it starts going the other way around, you get deterioration of health. This is a proven fact. You don't have to prove it again. So tackling your psychology by emotions, for that you need to understand the emotions. You have to recognize the emotions. Your perception of emotion depends upon your vocabulary of emotions. If you know the name of an emotion, you can perceive it. But if you don't know the name of emotion, it is very difficult to perceive it. You can experiment with yourselves. You try to think about it. You try to write down the names of emotions that you know. If you start doing it in Marathi, you will hardly reach 30 or 40. If you write in English, you might reach up to 150. I've tried to enumerate emotions in Marathi also, and I've tried to reach almost 140, 150. You also try that. You need to understand the emotion before you try to treat the patient by music or by anything, any other. As sir said, patient comes, you have to understand what is he going through, what is his prevalent or current emotion, and then you can tackle it properly. Just as he said, just listening to him also gives him a great relief. That's because we are tackling his emotions. It becomes very difficult for us to understand emotion. So there is a software, an AI based software made by an Indian company in Pune. You just sit in front of the mirror, the screen for 1 minute with your eye movements, your muscle twitching, your neck movements, your breathing pattern. In 1 minute, it gives you a emotional graph of that person. In 1 minute, you can try it. It is with me. I do it every time. So first we ask the patient to sit in front of the screen. We actually graphically note the emotion, the prominent emotion of that person. Now we have to match that emotion with the music. If the patient is angry, you cannot start some vague music. You have to match his music. Or if the patient is sad, maybe it's because of cancer diagnosis, you cannot start some lively Ganpati type music with him. You have to start with the music that matches his current emotion. Then he will accept that, and then slowly come towards the positive emotions by using various software apparatus like DJ apparatus. So it's a big huge thing. We have a lot of thought has gone into it, but these are other components which recognize music and their impact through mutual relation. Something what happens is that when a music therapist is giving music therapy, he also is getting treated because he's also listening to that music. He's also doing all those things. So it is a kind of mutual thing that's happening, and that's very dangerous for human beings. When we become doctors, they say that you have to be uh, aloof or away or detached from the patient's emotions, not get involved into that patient's. But music is such a spiritual thing that finally it can go to your self search of yourself. It can be a very high spiritual goal, which is a goal of our life anyways. So music can help us go there to reach that stage, and while doing that, it can make many lives happy. Thank you.
Thank you, sir, for your enlightening session on Indian classical music therapy. Your insights into the profound impact of music on healing and well being have truly inspired us.